Here is the infraclavicular brachial plexus block mini-sim model. This model is perfect for training, teaching, and practice on how to perform not only an infraclavicular brachial plexus block, but also PEC blocks such as PEC 1 and PEC 2. It can also be used to teach, train, and practice serratus blocks. What makes the mini-sim models really unique is that a lot of time, research, and development was spent optimizing the anatomy of the structure of the model. In fact, the appearance of the model is almost identical to that of a human body. This is because the models were scanned from an actual human being. Afterwards, 3D printing technology was used to create the bones and the bony structures. So it is really very realistic. As an example, in here you can see the sternal head of the sternocleidomastoid muscle and the clavicular head of the sternocleidomastoid muscle. You can see the clavicle, you can palpate the coracoid process, and you can see the deltopectoral groove. The look and feel is so close to an actual human body, it allows much more realistic training, teaching, and practice. All mini-sims are also characterized by a very unique and textured material that is also multi-layered and is very reminiscent of human skin. It even has the same palpation characteristics, which just adds to the realism for lifelike training and practice. So now let's see the mini-sim in action. Here is the linear probe that we're going to use, and first we apply some gel on the transducer. We're going to orient this to be our superior or cranial direction of the probe. Normally, for an infraclavicular brachial plexus block, the procedure is to position the transducer very close or right over the coracoid bone. Here we apply the transducer. Now we will increase the gain, just slightly. We're searching for the coracoid process, which we will now see in the ultrasound image. Once underneath the coracoid process, we rotate the transducer slightly to see the pectoralis major and minor muscles and the chest wall, which appears as we tilt the transducer medially. As you can see, imaging on the mini-sim is very realistic and lifelike. In this particular image, we see the large axillary artery and the axillary vein, and we also see elements of the brachial plexus. Here we see the lateral cord, there's the posterior cord, and here is the medial cord. To perform an infraclavicular brachial plexus block, what we would like to do is take the needle and insert it in plane from cranial to caudad direction. Here we see the needle insertion. In this case, we're going to pull the needle back, reinsert, and now we see the needle passing right next to the axillary artery. Next, we're going to increase the angle to pass by the axillary artery and position the needle tip just posterior to the axillary artery. An injection here would then spread the local anesthetic in a U fashion around the axillary artery to result in a brachial plexus block. Mini-sims allow practicing injection because they are built to allow the actual injection of fluid, in this case sterile water. Any remaining fluid can simply leak onto the specially designed trays for less spillage and easy cleanup. Let's go back now to see the image of the needle. We see the needle on the screen, and here is the injection. Practicing on a mini-sim is a very lifelike experience. We don't want to inject too much fluid, but just as much as necessary to document the accuracy of our needle placement. This model, as mentioned, can also be used to accomplish training for PEC blocks. In that case, one can use either an in-plane or out-of-plane approach. The needle is again inserted into the plane between the pectoralis major and pectoralis minor muscle. And again, one can inject sterile water to witness the spread in a particular tissue plane. And this was the PEC block. To practice a serratus block, we slide the transducer laterally to the chest wall to visualize the fourth rib. The structure seen on the surface of the rib in this position is the serratus anterior muscle. And again, using an in-plane or out-of-plane technique, it is possible to practice the proper placement of the needle. Let's use an out-of-plane technique now. Here's the appearance of the tip of the needle. And as the needle goes deeper, we're going to adjust our transducer until the needle contacts the rib. Let's practice this one more time. The rib is at a depth of about 3.5 centimeters. For an in-plane placement of the needle, we will increase the angle. And there we go. There's contact with the rib. In this needle location, one can also insert injectate. And there we go. There's the injection. Once again, this infraclavicular model also allows training on PEC blocks and serratus blocks. Finally, this model allows you to visualize the chest wall. Visualization of the chest wall adds another layer of safety, and that is one of the most important benefits of practicing on mini-sims. Clearly, entrance of the needle into the chest wall cavity in actual patients would result in a pneumothorax, which must be avoided.